Right. Hello, everyone. Good morning. Welcome, and thank you all for joining us for our third annual recovery celebration. My name is Rhiannon Edwards, and I am the executive director of PACE. We want to thank all of our panelists and all of you for taking time out on your Saturday to join us to celebrate National Recovery Month. PACE is a reentry organization located in the Martindale Brightwood neighborhood. For 60 years, we've been providing reentry services to this population. As advocates for the reentry community, our purpose for today's event is to shed light on the impact addiction has on the justice involved population and to hear possible solutions and resources that can bridge that gap. I would like to now introduce Gina Fears, our Assistant Director of Recovery and Community Services, who will serve as one of the moderators for today's town hall meeting. Gina brings 24 years of professional and personal experience in the field of reentry coaching and was named 2019's Indiana Recovery Advocate of the Year. As the leader of PACE's Recovery Resource Center, Gina knows the value of building partnerships, which is fitting as the theme of National Recovery Month is celebrating connections. Welcome, Gina.
Thank you, Rhiannon. And I would be the one to have a little bit of tech today, but thank you so much for allowing us to have this event today. We love our annual celebration, but just to make sure that we still are in the mode of celebrating and that we are safe, and that we still meet our mission of that celebration and bringing information. We're here with this forum today, and so very grateful for that. I want to start our time together by recognizing and thanking some special guests that have joined us today. And so we have with us today Senator Gene Breaux and Senator Greg Taylor. We also have Indiana State Representative Cherish Pryor and State Representative Vanessa Summers. Also, our very own council person for this Martindale Brightwood area, Councilman Zach Adamson is here with us, and also our friend, Councilor Lakeisha Jackson. Thank you all for joining us today in this event, as you have continued to do in all of our previous events. I want to also just take a moment to thank our sponsors for today. First and foremost, the Indianapolis Recorder. We thank you so much for the partnership and the opportunity to partner again with you to present this forum this morning. The Harrison Center, the Indiana Addictions Issues Coalition, our friends at Overdose Lifeline, the MOVE group in the Martindale Brightwood area, Representative Shackelford and the Shackelford Steps for Recovery 5K Fun Walk. And we will be excited to get back to that next year. Date your calendars for September 18th as our walk will take off again. And then Eastern Star Church that serves in this area along with us. I'd like to also introduce my co-moderator today. He is Mr. Darnay Scales, and he is the mission manager at the 100-year-old Eastern Star Church. He serves under the leadership of Dr. Jeffrey A. Johnson. Darnay has been employed there for almost 13 years and has a passion for helping those in need. Eastern Star's Rock Initiative and Care Center are amazing assets to this 46218 area, providing emergency rent, mortgage, and utility assistance, food, clothing, counseling, and prayer. We're happy that Eastern Star joins us today as a sponsor and has also allowed Darnay to join us as a moderator. Welcome, Darnay, and would you please introduce this next young lady that will share some information with us?
Thank you, Gina. I'm glad to be with you today and our panel. I am excited to introduce Ms. Jenny Reed. Jenny is a former client of PACE, and now she's employed there as a diversion specialist. So we welcome you, Jenny, this morning, and we ask that you share your personal story with us.
Thank you very much. My name is Jeannie, and I just want to thank you guys for sitting down on a Saturday morning and having this conversation. That is a marvelous and wonderful thing. I was excited when I woke up this morning knowing that we were going to do this and get some awareness out there and some recognition. So this is Recovery Month. You know, that is a wonderful thing. We are speaking about this. We are putting it out there, and with these kind of platforms, we're going to continue to let people know that this is an illness. This is not something that needs to be behind closed doors. And with that being said, I am a person who was locked behind some closed doors because of my illness, and pushed away and put away for an illness that I had no control over. That is scary in itself, to think about all these people who are locked away because they are sick. So anyways, let me get a little bit personal. I will be completely transparent, and excuse me if my voice goes up and down because I am nervous. So a little bit about Jeannie. Like I said, I am a previously incarcerated person, and I also struggle with substance use disorder. Today is a lot different than years ago. So let me go back a little bit. A lot of my situational stuff had happened due to my illness. I was acting out and committing some crimes due to being a person with substance use disorder. And I have served a lot of time away, and I wasn't able to understand or even comprehend why I was doing the things that I was doing. So it was confusing to me. I didn't have any kind of support. I was put into a cell, and the issues weren't being addressed, right? I was just out of sight, out of mind. But in those situations, I was stuck in my mind. So, like I said, pardon, my kitty cat is annoying. So we're talking about justice involvement and how addiction impacts what we are doing, right? Just because we have an illness doesn't mean that we are criminals. You know what I'm saying? Some of those acts might be criminalistic. However, it doesn't mean that we want to or that we do. Substance use disorder is a hush-hush thing. You know, there's a lot of shame, stigma, a lot of darkness that goes behind that. And things like this, hopefully we can break down some of those barriers, right? Letting people know, the community know, that we do have an illness. We don't intend to be hurtful or harmful to other people. We do, though. I don't know. I think that my personal journey is amazing in that sense that I was able to find support, but it wasn't easy. While I was away, I knew that I needed to change my life. I just didn't know how. And in the place that I was at, they didn't even know how to direct me to where I needed to go. I had to find those things on myself, and that's very restrictive. I always say that I had found this little pamphlet in a reentry book binder. It was a huge binder with a lot of inaccurate information. And I found this little pamphlet all wadded up, and it was a pamphlet for PACE. When I was released, I went running into PACE, right? I had no idea what I was going to do, where I was going to go, where I could find support that I so desperately seeked. A lot of people are unable to find those little pamphlets. You know, they don't know where to go. We don't know what to do. Whether or not for me, it was a need and it was a want, and I wanted it, but I just didn't know where to find it. Thank God I did find it in this little building off of Keystone Avenue. You know, I had no idea that that place even existed. So successful reentry. We hear that all the time. We hear that a successful reentry is successful. However, a lot of people don't even know what reentry means. They don't want to re-enter back into the life that they were living, correct? We do these things and we don't want to be like that anymore. On this journey, this recovery journey, I have found support and I have been able to connect to some vital resources. However, it wasn't something that was just flashing out there, you know. I feel like a lot of times that stigma of justice involvement and substance abuse is people put up an opinion, a stereotype, that stigma related things. This situation, this is increasingly, I see people all the time. I have seen people all the time in incarceration who struggle with substance use disorder and have no resources while away. So when they do come back out, they do what they do to survive. They don't have resources in housing, transportation. They know what they want, but they have no idea how to get there. And we've got to make that aware. We've got to put it in flashing lights. I feel like that's a must. I feel like I'm going off a tangent, so let me reel it back in. Recovery Month is a great way to give a voice to something that not everyone wants to hear. You know, a lot of families, a lot of people, even the community don't want to talk about it, you know, and we have to. This journey, I went from being an incarcerated person to coming out and not knowing anything about how to live, how to obtain a job, how to make connections with resources, how to even speak, you know, how to use this voice that I have. Hey, I am not this person who is a criminal. I'm a human being who suffers from an illness and I need help. I need help. These things that we need help with, no one really knows how to get us there, you know. Why is it that when we get out of incarceration, that's when that process starts? How come it can't start prior to release? You know, why are we looking at it at when you get out, when you get here? These places that people are wanting to put us. Well, when you do this, then we can do this. And when you do this, because not everybody's the same. My path isn't the same as the next person who's coming home's path, right? I think that everyone needs a helping hand, especially when you struggle with this illness. There's a lot of barriers when people come home, as far as where do I go and what do I do? And places in this conversation here, that's going to help those people. I am a person in recovery. I have successfully re-entered into the community. I love my community. I'm giving back to my community instead of taking it away. But we can't do it alone. We need help from our friends here. Thank you for letting me speak with you today.
Oh my God, Jeannie, thank you so much. I just absolutely love when you share in your transparency. It's just so refreshing. It's honest, and it's heartfelt. And thank you. And I know that you've set a tone for what we are going to do today. And so I am so very proud of you. Proud to be able to watch your journey. So thank you again. Darnay, we have these amazing people that are spending time with us today
Yeah.
as our panel. And so I'm wondering if you will help me and we can introduce our panel now.
Okay. We have with us the Honorable Robin Shackelford, Indiana House of Representatives, 98th District. Good morning. Mr. Douglas Hutzinger, State of Indiana, Executive Director for Drug Prevention, Treatment, and Enforcement. Welcome. And Councilman Bob Osley, President of Indianapolis City Council.
And we also have with
Welcome,
us Mr. Brandon George, and he is the Executive Director of Indiana Addictions Issues Coalition. And my friend, Dr. Brad Ray, is Associate Professor and Director of the Center for Behavioral Health and Justice at Wayne State University. And Brad, as we always say, it doesn't matter how far away you go, you still belong to us. So just grateful to have all of you with us today. Brad, I know in previous conversations with you, we've been learning about the rise in overdoses this year, 2020. Would you please take this time and share some data with our audience so that they are able to have some of the same information we do as we begin this conversation?
Absolutely. Thanks for that introduction, Gina. Thanks for sharing as well. I think that's great. So I want to start out, I'm going to share my screen here. Hold on. So I just want to start out by talking a little bit about how I got involved in this. I lived in Chicago in the early 2000s, and somebody very close to me overdosed on heroin. And I was in that difficult decision to make a phone call to 911. And I saw somebody, a loved one, revived by naloxone, and it changed my life. And after that, I ended up doing some work with the Chicago Recovery Alliance, which is a harm reduction syringe service program in Chicago, Illinois. I started out there doing interviews with injection drug users and later went on to map out where overdose events were occurring in the city of Chicago to advise where they might put syringe services programs, because research suggests where there are syringe services programs, it actually reduces subsequent overdose deaths. And it was during my time working there that I learned about harm reduction. I didn't really understand it as a philosophy. It seemed more like a practice to me. But I did learn the idea of that I take with me now, that as everybody has a unique recovery journey. And given that, I ended up adopting this thinking that any steps in the right direction towards decreasing risk are steps in the right direction. So any positive change is really how I look at this. And you'll see that come through some of the data that I talk about today. I want to start out talking about national data and then hone into Indianapolis specifically, but I want to talk about this metric, this number that came out in 2016. I remember exactly where I was when I heard this, that opioid-related overdose deaths had surpassed motor vehicle accidents as the leading cause of accidental drug overdose deaths in our society. And when this metric, when this number came out, it was a real call to action. A lot of people had started to see this was a real problem. We needed to do something about it. But I think we missed something when this happened. We missed the kind of crucial question that I think a lot of Americans didn't get an answer to, which is, why are you comparing overdose deaths to motor vehicle accidents? And that answer is important. It's because it's the leading cause of accidental deaths. That means they're preventable. Preventable by changing behaviors, preventable by changing policies, but that's something we can reduce. And all that time, when motor vehicle accidents were that high, I very rarely heard people say we should get rid of cars. I heard about how to make cars safer and drivers safer. And I want us to try and take that into the conversations we have today with this overdose epidemic. And the reality is we have over 70,000 Americans dying per year And you can't get into recovery if you're dead, all right? Now, one important thing to let everybody know about it, I want to have focus on changing the conversation a little bit, is I like to inform people that there have been 4 waves to this recent overdose epidemic. That first wave was the prescription opioid, when we saw prescription opioids starting in our society to be overprescribed. In 2012, it shifted over as prescription opioids became less available, people moved towards heroin. And in 2014, they moved towards fentanyl. And I need to tell you, this is not prescription fentanyl, this is illicitly produced fentanyl, all right? And then can everybody see the stuff on the right there? Is it just my screen? Okay. And then the more recent wave is of illicit stimulants, so methamphetamine and cocaine. But I want you to focus on the right there for a second, what the leading substances that are attributed to overdose deaths are. Number 1, fentanyl. Number 2, illicit stimulants. Number 3, heroin. And number 4, prescription opioids. Again, we need to change this conversation. This is not a pill problem. This is an illicit drug problem now, all right? Many people, so just so you know, the CDC data is only available through 2018. It's always very lagged when we can see nationally what's happening. And while there's a lot of celebration about reductions in overdose deaths in the 2018 data, I'm here to tell you that those reductions were only experienced amongst whites in the United States. African-American deaths continue to increase in 2018, and particularly in urban areas, all right? We have had a great partnership, my research team and I have had a great partnership with Alfie Ballou at the coroner's office for many years now. And we have actually been tracking substances that are in accidental overdose deaths since 2011 in real time as closely as we can. So I'll present some of the post-COVID overdose data at the end of this. But as you can see there, this data is from Marion County, that we see this huge rise in fentanyl detections in Marion County starting in 2014. So you can see here, we did some figures where we were looking at when exactly fentanyl hit, and we did some very early modeling to see, well, who is being impacted by this? And back in 2017, we were among some of the first people, and this is again, data from Marion County to say there are becoming massive increases in overdose deaths amongst African Americans, all right? We started to look at this from a polysubstance use angle, and it's important for everybody to know very rarely does anybody die of an accidental drug overdose from one substance. It's usually multiple substances. And what you can see here is that we've continued to see this overlapping line between cocaine and fentanyl with individuals that are coded as Black in the death certificates, again in Marion County. So a lot of times people see these things on social media where they'll see marijuana is laced with fentanyl or cocaine is laced with fentanyl. It's important to know that if you dig into some of those stories, those are post-mortem toxicology results. So we find marijuana and we find fentanyl in the post-mortem toxicology results, and we're making an assumption that they were contaminated. The only way to really know is to test the substances at the scene of the overdose that we think that those persons consumed. And I'm here to tell you we've done that in Marion County. Through a partnership with Notre Dame, we took substances, we tested them on a mass spectrometer for 1 full year. And the 2 things I want you to understand from this, the results from this is 1, there really is no such thing as heroin anymore. Almost all heroin has fentanyl in it. Again, we need to change that dialogue around what people are dying from. The other thing to know is we did not very commonly find cocaine mixed with fentanyl or fentanyl mixed with cocaine or fentanyl mixed with meth. When we did, it was trace elements like they had touched each other. And instead, what we tended to find at the scene was fentanyl and cocaine or fentanyl and meth. So there's a level of co-use here that we haven't seen before. And I think we need to think about that as this conversation evolves. When we look at the COVID epidemic, the pandemic that's occurred since the stay-at-home orders, there has been a significant increase in overdose deaths in Indianapolis. It's gone from 1.2 deaths to 1.6 deaths per day. I will tell you that we would normally expect some little increase in the summer regardless. We've compared this to previous years. This is a significant increase that has resulted from COVID following the stay-at-home orders in Indianapolis. The other thing I want you to know, though, is that when we look at those actual substances that are being detected in those overdose events, it is increasingly fentanyl. Fentanyl has been detected in almost 90% of overdose deaths since the stay-at-home orders. So we have a pandemic right now, a global pandemic that is disproportionately affecting African Americans. We have an overdose epidemic that is disproportionately affecting African Americans. These have come together in a syndemic that is disproportionately impacting African Americans. So I'm going to stop there and allow the conversation to unfold. Let me stop sharing my screen here. There we go. Thank you.
Wow, Brad, that is a lot and very eye-opening. And so I'd like to hear from our panel at this point, and hear some of their responses to this information. I'd like to start with Mr. Huntsinger, and then Representative Shackelford, and if you could both speak to us about what your suggestions might be to, one, your responses to the facts that you've just heard, and then what suggestions you might have on the state level to look at the possible solutions to some of these issues, the pandemic, the epidemic, and then even ensuring that the African American population is not left out of the resources that we would supply. If I could hear from the two of you, please, if we could all hear.
Well, first, thank you so much for having me. This is just such an important conversation to have. We're seeing very similar things statewide. We've seen a 79% increase in overdose events in our emergency departments. And early on, we began to see naloxone administrations by EMS climb. And with that, we know that fentanyl is highly lethal. But we also know that naloxone is can reverse an opioid overdose. And so this summer in May, we announced a partnership with Overdose Lifeline to it's $1 million for 25,000 doses. So if anybody needs naloxone, please reach out, overdoselifeline.org, and please carry naloxone. If someone is having an opioid overdose, this drug can immediately reverse that. And so that's the first thing that we can do to ensure, and most important thing we can do to ensure that people have a second chance.
And thanks, Gina. I just wanted to give a couple of recommendations after hearing that data, which I think is very telling that there are disparities that exist when it comes to addictions. At the state level, I would say we definitely need to make sure all funding is for all drugs. A lot of times we have been focusing on opiates this recent last budget year, but whenever we're going to give funding, it needs to be for all addictions and not just specify which drug we're actually going to focus on. Second, we need to continue to collect the data by demographics and identify those disparities. At the state level, we are very hard to actually do any action unless we have data. So keeping that data up to date and making sure we identify those disparities and the reports actually get out to the legislators that they need to get out to. Lots of times we have reports and we just get an email saying a report has landed in the report portal, but we need to make sure that those reports are landing on our desks, and then we can draft legislation to try to make changes to these disparities. And then last, I would say when it comes to disparities found like fentanyl, we need to prioritize. If this is one of those drugs, one of those additives that's making people even more addicted, more sick, then we need to put that as a priority and make sure that we're addressing and give more resources to those type of drugs.
Thank you, Representative. Thank you, Representative Shackelford. Mr. Huntsinger, I'm going to come back to you for just a moment. At that state level, as we're looking at the partnership with Overdose Lifeline and the opportunity for everyone to access Narcan, how would you say, actually, I think this is a two-parter. One of the things that Jeannie talked about as she spoke with us was the lack of information as she was in our state facility that would bring her to the point of recovery. And can you connect that and then also connect how are we going to give information? It's great to have the partnership, but how are we going to get this information out to the community that this is available to them, that this Narcan is available? One of the other pieces that Brad talked about was to be alive is to have the opportunity to get to recovery.
Absolutely. So one of the first things we have been working that we started working on in 2017 with the Department of Correction is redoing the way in which we provide treatment. One, ensuring that the treatment that we're providing is evidence-based, and two, ensuring that we have strong connections to those recovery organizations upon release. And so we've also implemented MOUD treatment in all of our facilities. We started with some small scale pilots and we have moved that to implementation. But the sooner we can treat people, the better chance they have upon exit of incarceration. So that's the first thing we can do. Over the summer, we've worked with a couple groups to have some conversations around how minorities access the substance use treatment system. And it was really telling. One of the things that that sort of struck me the most was that people want a treatment provider that looks like them and has similar experiences and understands them. And that was a light bulb for me. I want the same thing. And so at the Division of Mental Health and Addiction, we've been looking at how do we encourage and how do we provide opportunities for young kids to be exposed to behavioral health careers. But also then how do we incentivize people to specifically go into our underserved communities across our state, not just urban, but also we have similar disparities in rural areas as well.
Thank you so much. Thank you for your answers. Councilman Osili, with the same thoughts in mind, what do you see that we can begin to look at and we can begin to implement on a local level, looking more at the Marion County area and recognizing the data that was presented today within Marion County? What would your thoughts be on that?
I've got two main thoughts, and thank you for the opportunity this morning. I've got two main thoughts, and Doug just touched on one of them, and that is looking at basically our revenue and profit model. How do we incentivize our community-based organizations to go into our households? And how do we standardize that in such a way that they find the needs, identify the needs, and get them back to entities that can then administer a treatment for those needs? There is no one better able to address a need than someone who is actually in a community. A friend said to me the other day that, folks at the State House and, in state government and in local government, try to tell others within communities what's best for them. But we've got to be able to hear what is best for them from the people who are most impacted, who are actually there. And then we have to have our ears open to that. So this is not a short-term thing, but it is something that we need to have as a focus. How are we helping to incentivize those community-based organizations? So that's one. The second, one of the questions I have for Dr. Ray is, can we identify the causes of the escalation of those increases? Because we see them and we have in many ways attributed to the overall trauma of COVID, but are there other things that we can look at within those individual households that can better identify for us the things that we could better target to alleviate some of the trauma that is being encountered? And if I could just add on a third one, the analogy to traffic accidents is a powerful one, because I think that if we had that kind of escalation in vehicle accidents based on some component within a manufacturer's vehicle, within a car, those cars would have been pulled off the road, called back, and fixed. So we have this increase that we recognize as fentanyl. At the federal level, what are we doing to actually identify and crack down on the manufacturers of those things. I feel like we are working around the situation without identifying the actual cause of some of this explosion. And that can't be missed. So thank you.
Thank you, Councilman. Brad, I do wanted to take a moment to try to answer that one question of whether we can identify exact causes. And then I want to get to my friend Brandon. I can see Brandon itching to share, and I want him to, because he's got some good stuff.
Just to the point of, how do we address fentanyl at the federal level? I wish I had solutions there. I wish I had answers there, and I don't. But what I will tell you to Ms. Shackelford's comments earlier, there will be other substances that come next. It won't end with fentanyl. If we got rid of fentanyl, it wouldn't stop the problem. Substance use disorder is the problem, and substance use disorder comes from a life course of, as other folks have pointed out here, trauma. So we know what causes addiction, and again, I don't know that we want to always focus on the specific drugs to get to the underlying problem, but to get to the sort of issue of the day, I do think we need to focus on fentanyl. So, yeah.
Thank you, Brad. So Brandon, I have 3 questions for you. I'm going to go ahead and give you those. And if you can share with us, what is it that you believe that we can do on this local level to expand the access to recovery supports, thereby reducing death, and specifically amongst people of color? And then could you also speak to the need for harm reduction and education about that in our community partnerships? And finally, what do you think about the needs for more cultural trainings as we begin to look at our solutions, and why do you think it's important?
Absolutely. Gina, thank you for having me, and Pace, thank you for lifting the voice up around this conversation. It's really important right now. September is Recovery Month, but quite frankly, it's been pretty hard to get motivated to cheer about Recovery Month when you hear the data that Dr. Ray just mentioned. And if this was 6 months ago, I would be giving the governor's office high fives and the legislature and everybody on all the work that's been done, because we made so much progress, it felt like, over a couple of years. And then now we're in this situation where overdose are skyrocketing. It's clearly impacting our Black and brown communities at a much higher rate than it is folks that look like me. And then that compounds the issue, because we also know that people from our Black and brown communities have a much harder time accessing evidence-based treatment. There was a study done earlier this year that even African Americans with proper insurance are 50% less likely to access treatment that involves medication for opioid use disorder. And we know that's a huge piece of the solution here. And I really want to echo what Dr. Ray and Representative Shackelford said about the need to make sure that when we are getting funding to the local level, that it involves all drugs. As advocates, we've been yelling that this isn't a prescription drug issue anymore for years. But we also know and we recognize that a lot of the leadership's hands are tied because the federal funding is tied to opiates. And so we've had to kind of ride that out. But that has to change. And I think that as we get funding from the state to the local levels, we need to make sure that we can get it to the people who are most in need. And a big part of that is recovery support services. We really hyper focus on treatment, but the reality is treatment's just a sliver of the recovery process. That's the acute intervention, right? The 7 days, the 14 days, the 1 month. I want to know, how are we going to get that help to Jeannie, right, when she was sharing? The people that are closest to the to the solution are the people that are closest to the problem, right? Let's talk to those people, because they really know how to find a solution to this. And like she said, how do we touch those folks earlier? How do we talk to them before they're leaving corrections? How do we talk to them before they're leaving other settings and get them wrapped up in those community services that Councilman, the President was talking about, those community-based services and community organizations that can really reach in and help folks. And so, unfortunately, something I realized when I got into the recovery movement a couple years ago is that it all looks like me. It's a very white-centric recovery movement, and that has to change. There has to be efforts there. I'm proud of the work that we get to do with PACE and some other minority-led recovery organizations to help expand that voice and try to hold some space to make sure that we provide pathways to recovery for everybody, not just folks that look like me.
So Brandon, I'm sorry, Brandon. I'm gonna just push you just a little bit. And I hear those things that we need to do. And what I would love to hear from you today, being the Executive Director of Indiana Addictions Issues Coalition, with a loud voice that covers this state and not just Marion County. What are you all suggesting? And what are you all helping we as service providers to do to increase the opportunities, and then also to maintain a focus on making sure that African Americans are included in the plans that we have for solutions?
Absolutely. So I've had to learn a lot along this path, and I'm used to walking in and trying to identify problems and coming up with a solution myself. And I think I met with Gina a couple of years ago and said, "Hey, Gina, it's clear that this isn't a diverse group in this community. How do I fix it? How do I or we?" And what I realized, the hard way is, it's not for me to do. It's for me to elevate other voices. And so what the goal has been, one of the things we've been working on with the state is a recovery hubs project that has different recovery hubs throughout the state. And we're dedicating specific funds from that to make sure that it's going to minority-led recovery organizations. I know that as far as advocacy goes, one of the things I've done, we've got a budget every year to do advocacy work. We've dedicated that funding to go to minority-led recovery organizations to help elevate this issue, to make sure that it continues to be at the top of the priority list. And then also trying to make space. We've got several speaking events that personally I've been invited to that we pulled other chairs up to the table. We've said, hey, I appreciate you inviting me, but I'm bringing X with me and Y with me, and we're going to have a different conversation, or this is going to be part of the conversation if you want us to show up. And so we're doing that. We're doing that in a couple of weeks and in a couple of different conferences. So those are a couple places where it's at. I don't want to steal the thunder of what PACE is doing or what we're collaborating on, but there's something cooking there as well that I think is going to be a big deal for the.
We'll let you share. Okay. We'll let you share it.
So part of that in trying to redirect some of these fundings to, again, minority-led recovery organizations is how do we increase pathways to recovery for our Black and Brown communities? And I shouldn't be doing that, right? That's not what Brandon should be doing. So getting together with Gina and Rhiannon and Pace and saying, what should we do here? What's the solution here? And so we're working with them. They're coming up with a tremendous training for the different pathways to recovery, specifically for our different communities. They've been working with Dr. Ray. They've been working with a wide array of people. And it's going to be something that's going to be part of essentially the curriculum, or what you have to do to be part of our Indiana Recovery Network, our Recovery Hubs project. And you have to work on this essentially. We can't sit by and say, okay, I hope somebody works on this anymore. I hope somebody pays attention to this anymore. At least I don't think that we can. I think that's an issue that needs to be forced, and happy to play a small role in that. And I appreciate you guys taking a leadership role in that.
Thank you, Brandon. Thank you so much for allowing me to push you a little bit there. Dr. Ray, I know that you have some other information that you want to share with us this morning, and I'd like to take some time here to just get some more factual information. We can talk around this all we want, but the facts don't lie to us. And so we'd like to hear some more from you, please.
Thanks, Gina. Let me share my screen again here. So let me just say, and I don't mean this to be glib or anything, but if you're not to the point where you see substance use disorder, opioid use disorder as a brain disorder, you're probably not going to be able to keep up with the rest of this. You have some Googling to do. But let me just tell you that it is. And if you're also in the mindset that you're just replacing one medication for another, again, I think you have some work to do Googling this thing yourself. But just so you know, medications for opioid use disorder. And the reason I want to talk about this particular subject is, as I said before, we're in the middle of an overdose epidemic. The substance that is most frequently killing people right now, African Americans in particular, this disparity I spoke of, are opioids. Medications for opioid use disorder are the gold standard treatment to get individuals into recovery. So the science tells us that these medications reduce drug use, opioid use, other risky behaviors. I'm going to problematize this point about that each modality should be provided with behavioral therapies in a second. But I think we need to dig in deeper. Instead of just saying treatment, I want to dig in a little bit deeper and talk about there are 3 specific medications that are available for opioid use disorder: buprenorphine, methadone, and naltrexone. You probably know buprenorphine by the name Suboxone and naltrexone by the name Vivitrol. I'm not a medical doctor. I've never prescribed any of these medicines. I'm a researcher, and I have to tell you what the research says, that these medications are not equal. Comparative effectiveness studies consistently tell us buprenorphine and methadone outperform naltrexone as sort of a benefited add-on, so that they have better outcomes, right? So I'm going to leave this information here so people can look into it further, but I just want to keep that as part of the conversation. I am particularly interested in getting these medications into incarceration settings. The reason is because, one, a lot of individuals going through these systems don't even know they have opioid use disorder. They've never been screened for opioid disorder. They've never had any treatment. And I'm particularly interested in jails, all right? People cycle quickly through jails. And what happens, the nature of opioid use disorder is that you develop a very rapid dependence to opioids. You become incarcerated upon release. You still think you can, you become incarcerated, you go through withdrawal. Upon release, you still think you can take the same amount, or you want to take the same amount of substances. Your body can no longer tolerate that, and then you have a fatal overdose. Individuals leaving jail have 130 times more likely to die of an overdose, all right? That time when people walk out of the jail, that is the crucial period. And even as said before they leave the jail is a crucial period to get this conversation started. In Marion County, to the best of my knowledge, I know there's been some attempts at this, but there's still no medications for opioid use disorder offered to individuals in that facility. When we look at that same overdose data that I described to you earlier, and I'll say up the road in Boone County, they figured out how to bring buprenorphine and other medications in. But when we look at Marion County, what we end up seeing is that about 30%, so 30% any given year, all the individuals that die of an accidental drug overdose death, about 30% of them were in the county jail in that year prior to their death, many within days of dying. That is the intervention point we need to focus on. 60% of the people that have died have been in that jail at some point, all right, in their lifetime. So that is a crucial intervention point where we can start to do something. Now, here's the thing, and we do this, this is some of the work I do in Michigan and other locations, but it's not just about getting one medication in there. You can't just get naltrexone in there or Suboxone and think, now we've figured this out. And it's not even about just getting all 3 medications in there. We have the hard work ahead of us of transforming these carceral systems into places where people get into treatment. We need to screen individuals that are coming through our jails to see if they have opioid use disorder. We need to continue that care for those who have had those prescriptions. If not, many lawsuits follow for individuals who are not able to get those medications who are incarcerated. We need to have those psychosocial services available to individuals who don't, or who are on these medications, who might not want these medications. But most importantly, we touched on this already, we need a continuity of care plan. Folks need to know, where am I going to go to receive services once I leave this facility? And that continuity of care plan has to start as soon as somebody walks into jail. They're identified, They're able to get medications if they need them, and they're getting this continuity of care plan so they know where they're going upon discharge. So this is very important. And I have to tell you, we have sunk so much time, energy, money into this epidemic. And what we find, this study here is right before COVID. What we find still is that only a third of our programs in the US from the Secret Shopper study found that people even offered buprenorphine. And 21% of individuals were actively discouraged from receiving buprenorphine at all. So we need to do better work of getting buprenorphine. And I say this because I think we need to get more specific about substances. We can't just say treatment, all right? This is the treatment we need to be trying to move out there. We need to get it to folks that are in incarceration settings. So one of the things I want to talk about, a movement that people are talking about right now, low threshold buprenorphine, also known as medication first. So this is getting people buprenorphine right away, kind of on their own, with some patient autonomy put in there, and rapidly getting them the buprenorphine. And just to explain what those differences look like to individuals in this traditional setting where people would have gotten buprenorphine, it was multiple office visits. They might have multiple office visits before the medications was provided in an office. Now through COVID especially, people can get buprenorphine through the telephone. They can get it prescribed, get a same day prescription. In these low threshold programs, the patient goals are prioritized. It does take very much of a harm reduction approach, right? Abstinence is not the primary goal. Reductions in opioid use are the primary goal. These substances allow individuals to do that. Buprenorphine allows folks to focus on their recovery, on their family, their friends, and getting their life in order instead of constantly consumed with where do I get my next fix, if you will. The other interesting thing about low threshold to know is that in the traditional setting, if somebody is co-using with buprenorphine, they would shut them off and say no more. In the low threshold approaches, they don't do that. And also they don't require intensive counseling, they recommend it. All right. So there's some differences there, and there's some really interesting programs coming up, and I'm always happy to share if folks ask, but just some examples of these. Our good friend and colleague, Dr. Dennis Watson in Chicago, he is doing some work where they're routing individuals directly from harm reduction services into buprenorphine treatment programs right from a syringe exchange site. There's some exciting stuff coming out of the street medicine team in San Francisco that's doing homeless outreach. And this P-Care model in Baltimore is actually a mobile van that's parked outside of a jail so that folks leaving the jail can get into buprenorphine. Now, I will say one of the things that we hear, and I know as doing work with local law enforcement especially, is diversion. People are always very concerned about the diversion of buprenorphine, all right? So I'm not here to tell you that diversion isn't something to worry about. It is. I want to contextualize diversion and tell you that all prescription medications are getting diverted, but talk to you about what happens with the diversion of buprenorphine specifically. Most people are not using diverted buprenorphine to get high. They're using diverted buprenorphine because they can't get buprenorphine through legitimate channels, right? So it's very like, if you think of prohibition almost, right? And what to know is when we see individuals who are in opioid treatment or an opioid use and indicate opioids as a primary drug and ask which specific opioid, very few, less than 5% say buprenorphine, all right? Folks sometimes misuse it through non-medical prescription drug use, which again, all prescription medications are used non-medically prescribed sometimes, but sometimes folks use it to what's called CHIP, in between illicit use. But the other thing to know about buprenorphine is even when non-prescribed buprenorphine is out there and used, non-prescribed buprenorphine reduces drug overdose and reduces decreased illicit use. So one of the things my team and I use to look at illicit drug cost prices and the sort of prevalence is this Street RX, and folks can look this up and you can search for drugs and see where they're the cost of illicit drugs. And I often ask this to people when I'm in larger groups or when we were in person, but if you've ever known anybody that's used Viagra. And usually when I ask people, do you know anybody that's used Viagra? I'll ask and people raise their hand and I'll say, do you know, did that person have a legal script for Viagra? And what do I end up finding is that a lot of people don't. Viagra is a diverted substance. You know what else is a diverted substance? The group I ask sometimes about is college kids. Have you ever used Adderall? and they raise their hand, and I'll say, how many of you actually had a script for that Adderall? And as you'll probably guess, very few do. Adderall is a highly diverted drug. So diversion is a problem. I'm not saying it's not, but it's not an excuse to not provide the gold standard treatment for opioid use disorder in the middle of an overdose epidemic that is driven by opioids. So I think we need to get a little bit more specific in what we mean about treatment to address this particular epidemic at this particular time. So thanks again, Gina.
All right, thank you, thank you. Dr. Ray, I just want to say that it has been such a pleasure to work with you, to be a part of research that you're doing, to receive information, which I believe helps us to all better look at what we are offering when we speak to treatment and when we speak to recovery support. So thank you so much. And our other friend, Dr. Watson, we thank him as well. I'd like to come to our panel here for just a bit and just throw the term harm reduction up in the air. And I recognize that this is not something that we've always looked at as possibility or pathway of recovery for individuals. But I refer again to the first set of information and data that we received from Dr. Ray, which said to us simply that if we don't keep people alive, we cannot get them to that place in recovery that is most hopeful. So I would like to start with Councilman Ossoly, and then also hear from Mr. Huntsinger as we speak about getting these life-saving substances and this type of treatment into our jails and our other correctional facilities. What are your thoughts, and do you see ways of being helpful in making that happen? Councilman Ossoly?
Thank you. And what I should have done when I first got started was to say thanks to PACE as well. I am just an honored board member for a number of years, and the work of PACE is phenomenal. So I think it's something that Councilwoman Jackson is leading in the council right now, and it is the distribution of reentry packets for individuals who are coming out. And I know that PACE has worked for a long time to get into our jails here to better prepare individuals for when they are coming out. But just listening to Dr. Ray and thinking about the additional assistance that is needed, and then the ongoing assistance that is needed, I think that we still have work to do to ensure that it's not a one-time hit, that we give an individual who's coming out assistance, but that we are able to follow that individual, if that individual is agreeable to that, moving forward. So I'm not sure if that answers your question. We are moving in that direction now, as I said, with the reentry packets and working with entities like PACE. But I think that we may be missing that longer term care, that longer term engagement, and formalizing that longer term engagement. One thing I neglected to mention the first time was something that we are also missing, and I think that is getting into households, the destigmatizing this concern about addiction. When Ms. Reed, she said something that that was key, and it was an illness not to be locked behind closed doors. Mm-hmm. And anything that you want to address, any issue that you want to address, has got to be brought into the light and discussed. We have to find ways that we destigmatize addiction and are able to see it for what it is, an illness, and then to speak openly about it in every sector of our community, from church to social gatherings, to family gatherings, to educational gatherings. And that is something that I think that we have not done collectively well, but that we need to.
Thank you, Councilman. It's as though you've read the rest of our notes and know where we are going from here. Mr. Hunsinger, we'd love to hear from you.
Yeah, well, thank you. You know, getting evidence-based treatment and MOUD into our correctional settings has been a priority of the governor's. And so we felt first and foremost, we needed to put this into the Department of Correction first. Proof of concept around the state. If DOC can do it, then we can begin to spread the lessons that we've learned with our county sheriffs. And so last year we announced a $4.6 million partnership with the Indiana Sheriff's Association. And we've been working with Boone County. We've been having discussions with Marion and a number of other counties around the state. But it's not as easy as one would think. We have, and most of the challenges are rooted in stigma. We have providers, medical providers in our facilities that don't believe in MOUD. We have a lack of behavioral health care within our facilities. So many of these situations, we're introducing our sheriffs to their community mental health provider so that there is that continuity of care as people exit the system. But what I really, that stigma is a main component in whether it be within the jail itself or on the exit. Finding providers that are even willing to, one, work with our justice-involved population, and two, believe in MOUD. This has been something that we have been traveling the state, trying to connect those people who believe in this and understand our desire for evidence-based treatment. And I thank everybody on this call because Brandon has been a huge partner, our partners in the legislature, and Brad Ray, Dr. Ray's work and having the evidence has helped us change some minds. And the sheriff of Boone County has been a huge asset as he has helped us talk to many other law enforcement officials across the state.
Thank you so much. Thank you. So as we are here today, we have others that are listening to us they're on different Facebook pages. They are on Zoom, and some of the comments that are coming out are definitely about how we have handled past epidemics. This is not the first epidemic that we have worked on. And so some of those comments are saying, and I think we heard some of that as well when Jeannie spoke this morning, and with my own experience, I realized that as we looked at the crack epidemic, our way of working with that, I won't even call it a treatment or coming to solution, but our way of working with that was more of a law and order way. So definitely more incarceration as opposed to looking at the health issue in it all. And so our last two panelists spoke of stigma and what that does to the opportunity to come to any pathway of recovery, to come to a place of becoming free of the illness that we suffer from, ultimately that it may lead to full and total abstinence. And so we know that stigma in our respective communities plays a large role in how this happens. As we begin to wrap up our sharing time, I'd love to hear from each of you in your own sphere of influence. What can you commit to? What can you dedicate yourself to in working to reduce those stigmas? Councilman Osili, I love that you began to talk about that we will even work in our churches to reduce stigma. And when we do that, we will allow individuals, and all individuals, the opportunity to receive some form of recovery in their life. And we will keep people alive. And so what is your commitment as we wrap this time up? And we'll start with Representative Shackelford, and we will work our way around as I will just call a name as you all share. And these are just our closing thoughts, but please, the community that we live in, what is the commitment that you can make to them today? And take a look at the stigmas that exist. Is it about substances? Is it about races of people? Is it about these substance use disorder and opioid use disorder? Is it about money spent? What are those stigmas that exist? This week in the Recorder, there was an article that spoke to stigmas. And one of the things that we recognize, and one of my good friends shares with me all the time, that stigma is just the very, very simple way of setting certain people aside. It's the nice word for setting certain people aside. Representative Shackelford, would you share with us, please?
Yes, thanks, Gina. And I think you're very accurate in stating how we treated the crack epidemic versus how we're now treating the opiate epidemic. I know people have come to me and want to see if we can do some type of statewide diverse awareness campaign around the treatment of both of those epidemics and how it affected our community. Because you have some people on both sides where either they may not know, understand, or care to know what happened back then to people that was going through and being in prison for being on crack. So we need to educate them on actually what happened and why people feel this way when it comes to now this new epidemic and how others are being treated with prevention and treatment, and the penalty part is last. I also want to keep a lookout, and I will continue to do this, when we usually work on legislation dealing with addictions, we're looking at all three components. We look at preventive, treatment, and penalty. As more African Americans start to get affected by the opiate crisis, I don't want to see us now go towards more penalizing individuals in treatment. So I make sure I keep an eye out for that, because I think people, it's been kind of low key on what we did on the penalty part, but I don't want to see that rise in penalties as more African Americans start to get affected by this crisis. And then lastly, I do think we have to look at the other end for reentry when people come out. I will continue to work on legislation to assist formerly incarcerated people. It's an uphill battle. I know I had legislation giving tax credits to employers, but I think we need to do something to level the ground for when people come out, because right now we're just repenalizing them again, and they can't get certain jobs in certain industries. And a lot of time the reasoning is because the industries are government regulated. So whether it has to do with the healthcare industry, financial industry, mail, UPS or FedEx, anything that they think the federal government is regulating, that's usually their pushback on why they won't hire an ex-offender. And not only be on that offensive end, but defensively, keeping a lookout for legislation, because we continue to write in legislation that you can't hold a position in this industry if you have a former felony, whether it has to do with drugs or violence. So I'm constantly on the lookout. That happens a lot in Financial Institutions Committee. Recently, they didn't want ex-offenders to be able to work at buy here, pay here places or the quick day loans. Now, how that's related, I have no idea on why someone that's a former felon can't work at a quick payday loan place. So just keeping a lookout and advocating, and not only the jobs, but the services. We recently did finally pass that Indiana would now let people with drug offenses get food stamps. That should go into effect next year. So Indiana had to opt out, and we worked on that for a long time and finally got bipartisanship. But things like that, we need to go and fix a lot of this legislation that's really making it hard for offenders to come back and be in their community. So those are just some of the things that I will continue to work on.
Mr. Hunsinger? Thank you, Representative Shackelford.
Well, thank you. And it's conversations like today that that help move us forward. And it's so important as we travel the state that we talk directly about this. We've got to do more to educate people around MOUD and specifically, the justice system. It's not just people with substance use disorder, but people with mental illness who are also treated differently by the system. The government failed in the crack epidemic. And the one thing that I want to commit to is doing things differently and taking a different approach. And I think that's why our next level recovery efforts have been really focused on treatment, focused on justice, and ensuring that that we do everything we can to help people when they're in that situation where they, whether it be re-entering from a jail or the Department of Correction, but really just doing whatever we can. One, keep people alive. Two, make sure that they have timely access to treatment. And three, which I'm most proud of, is the work that we've done with Brandon and creating these regional recovery hubs. As Brandon said, I mean, treatment is just a small blip in that full continuum. And it is so important that we do everything we can to help people sustain and maintain their recovery. And so I want to thank you so much for having me. This conversation is something I have every day, but it is wonderful to talk to people who also believe in the work that we're trying to move forward.
Thank you so much. Thank you. Councilman Ossoly.
Thank you. I want to underline this issue of penalizing those who have addiction issues. The idea of going to jail for an illness or being penalized for that. We've got to elevate that discussion. And then the impact, the disproportionate impact that it has on Black and Brown brothers and sisters has got to be elevated as well. We've been trying on the council side to talk about equity and putting on the table race and racism and our history of race and racism in local government. And how do we identify it and we look at it straight in the eye and call it for what it is. But when we see that we've got still so many disparate outcomes, this just adds fuel to the need to address that. So you ask for pledges. I do make a pledge to elevate this issue of addiction, to work with my fellow counselors, to be able to work towards destigmatizing it, putting it on the table for discussion, and how then do we better address it with all of our community partners, all of our governmental partners like Representative Shackelford here, Doug Hunsinger, Brandon George. How do we do that? And then we have a collective voice in all of this. I'm a huge advocate of let's remove all the silos that we have and working independently. And how do we have the opportunity to get those resources and all that energy and all the thinking into something that is productive and that can move the needle and that engages with our community members. So that is my own pledge. Years ago, we did the ban the box ordinance, wanting to ensure that there was far less restriction on opportunities for employment for individuals who have been incarcerated. We got prohibited, at the state level a few years later, but that energy and that commitment still exists here locally. And just as I mentioned with Councilor Jackson and her work in reentry, we are still committed to it. We just, I think, have the obligation to work with more partners at the state level as well, and in the community. Thank you.
Thank you so much. Thank you so much. Brandon, did you want to share? I saw your note that you said you wanted to press that syringe exchange.
I do. Thank you. And I'm gonna make a commitment to actually all the other people we have on the call today on what some of the stuff I want to make a commitment to. I want to make a commitment to Brad Ray's data to make sure that we lean into the real solutions. We know what the solutions are to drive overdoses down. We just can't morally accept them. We need syringe services in every single county. We need buprenorphine coming out of the syringe service programs for low threshold, and that would reduce overdose like overnight. We can't stomach it. And so I want to work with our state legislators like Representative Shackelford. How do we make it so how are syringes illegal? How do we hand out felonies to people every single day? Possessing a syringe is a felony in Indiana. We got to change that. We have to change that. We have to get the sunset out of the syringe service bill to make it last forever. It failed last year. We have to get that. That 1-year extension wasn't enough. I know something the governor's office supports. I think collectively we can work on that. I want to stay in the governor's office and Doug's ear about really leaning into harm reduction and not just recovery and abstinence, which I know they believe in. I want to work with PACE to continue to make sure that we close this huge disparity in who gets treatment, who gets recovery, and who doesn't. And I want to work with Councilman Osley. How do we make Marion County the great leadership in getting the syringe service unanimously passed again? And how do we take that to the next level, right? How do we make it so we do have low threshold beep services out of a program like that? And so that's my commitment to everybody on the call today. And there's a lot of people on here that they got a lot of sway. Let's get some work done.
Thank you so much, Brandon. My commitment as I turn this time over to my co-moderator is that I will continue to bring these groups of people together, and I will continue to bring information forward and allow us to have, with good information, we can make good choices and decisions. And I will continue to uncover things and to speak loudly and to talk about things that are uncomfortable and push us to a new way of thinking, all in the effort to save more lives. So I'm grateful to have been here with you today. I'm going to give you to Dr. Brad Ray, who will have a closing word here, and then in turn, Darnay will come and he will take us to the ending of this program. Thank you so much for letting me serve.
So legitimately, we'll just say this is one of the panel I'm very honored to be on. And then to just kind of add to the commitment, I will say for me, I kind of continually try and figure out, it's very easy in academia to just kind of scream into a cave or where everybody agrees with you. And so I try and continually push myself to be in events like this, where this information isn't just residing in some ivory tower and we can get it out to people who can make it actionable. I just want to say Brandon's comment about the syringe services program, I can't say enough about that. That is just so important. The decriminalization of syringes needs to happen in Indiana. That would reduce deaths. But I also just want to go back to the stigma comment that you made and just some parting words to think about where we could all focus. I recently read an interview with Dolly Parton talking about Black Lives Matter. And one of the things that she had said in there that I thought was really interesting, she supported Black Lives Matter, but she talked a little bit about the sources of stigma. And some stigma comes from hate and fear, but some stigma just comes from an innocent ignorance, is what she called to it. So I think one thing we can all do to combat stigma is to go out there and find those people we know who are just innocently ignorant. They don't know what these medications are. They don't know what syringe service programs are. And let's educate those folks about that, because that's a low-hanging fruit, I think, that we can all get to and make really big changes in our own lives and in the world. So thanks again.
Thank you, Dr. Ray. Thank you all. It is encouraging to hear, your commitments to this issue, and just to stress the urgency of and the need for our continued work. I just want to state a few statistics. Half of the individuals incarcerated in the Federal Bureau of Prisons are serving for a drug-related conviction. 85% of all individuals involved in the criminal justice system have a connection to a substance use or mental health disorder. 62.8 recidivate on a technical offense which could be linked to a substance use disorder, and 44.7% of those who recidivate are African American. And with that, I'd just like to close on this last question, and that is, how do you all individually support reentry? Mr. Hutzinger?
Well, absolutely. I have met a number of people who have been in reentry, and one of the programs that a lot of people with substance use disorder utilize is Recovery Works, and so I'm a huge advocate for that program with the legislature, but also with the Division of Mental Health and Addiction that oversees it. And so I want to make sure that that program remains to be funded because it has been life-changing for so many people across the state.
Thank you. Representative Shackelford.
Thank you, Darnay. As I mentioned earlier, I will play both offense and defense when it comes to legislation that deals with helping former offenders get back into our community and get a job. But I also want to add what has been one of those biggest issues we touched on earlier is imprisoning people with mental health and using the jails as their mental health facility. We have to get a big advocacy, a big push to make sure this year we put enough funding so that people are not sitting in our jails with mental health issues, with addiction issues. We have heard from the Sheriff's Association, they say they can't handle the problem anymore. They can do addictions a little bit, but people are coming in with way more heavier mental problems that they're having basically to take care of, and they're not a health facility. So I say that will be one of my main things this session is making sure we put enough funding somewhere to build some type of facility to help with mental illness and not put them in our jails.
Thank you. And Representative Shackelford, thank you for your support of Eastern Star Church and the community work that we've done over the years. So thank you so much.
Yes.
Councilor Osley?
I think one of the main things that we can continue to do at the local level here is to continue to push for lowering the barriers for employment for individuals who have got criminal histories, and pointing those things out, talking openly about them, questioning why there are restrictions in place, and having people actually answer why, or to try to justify why they think it is important to have those restrictions. We don't have those anymore in the city of Indianapolis except for law enforcement, and that was part of that initiative that went with Ban the Box a few years ago. And we wanted to be able to lead by example here in the city of Indianapolis, city government. And I think it's time once again to call our corporate friends, to task on this. Let's get more opportunities for individuals who are coming out so that they can get their lives, back on track.
Thank you. Dr. Ray?
A lot of the ways I contribute are through research, which I know is pretty low impact, but I will say I do a lot of research on reentry with PACE, but I push myself continually to move my research further upstream so that we're not just looking at people who are returning from incarceration, but what are the interventions, policies, programs we can do to stop people from even getting incarcerated. And so for every hour I spend on something in reentry, I try and focus further upstream in those types of programs. And, in Marion County, you have things going like the co-response teams, MCAT, Behavioral Health Unit. And so if you think about this from a sequential intercept model, you've got those folks that are coming out. But how can we put resources to not even get people involved in these systems? And I think programs like that are excellent examples of stuff. So.
Great. Brandon?
Really committed to making sure that all of our 16 recovery hubs have individual relationships with every single county jail to help with that transition into the community. And then really personally using any ability I have with sheriffs around the state individually to get them to buy into the use of medication in their facilities, and just making a commitment to, if I have to, going to every single 92 county and help, show them why it's needed, because it saves lives. It literally saves lives, and we have to save lives right now.
Thank you so much. At this time, we'll close with the final speaker, and that's Sharon Rucker, and he's going to share his testimony and just to show how the importance of this work and lives being transformed. Brother Sharon.
Yes, thank you so much. Greetings to everyone. This is a very fruitful dialogue, and I appreciate you guys investing your time into some of the issues that are, in my opinion, are swept and brushed under the rug. So I think we'll get a lot done from this. And as I begin, I want the panel and those watching to just really imagine some of the things that I will share, while understanding that the things that you imagine are the reality for a huge population of people. So with that being said, my name is Sharon Rucker. I'm a native to the Martindale Brightwood community. I actually grew, born and raised, grew up there my whole life. So I kind of want you guys just to imagine growing up in a household, maybe a 2 to 3 bedroom house, 1 bathroom house, with anywhere on average from 6 to 10 people living in it. Can you imagine, turning on lights to roaches and rats running everywhere? Can you imagine being a child having to being embarrassed to have friends come over because of these things, or having to shake your shoes and clothes out to make sure the roaches are in there? Can you imagine being called derogatory names, by parents or people in your household, to the point where you begin to think, you begin to answer to those names as if it was your real name? Can you imagine knowing the difference between packs of cigarettes at the age 8, 9, or 10 before you probably learned how to write in cursive? Is it normal? You come from a community where it's normal for a 10-year-old to have a note to take to the local corner store to buy cigarettes for their parents and things of that nature? Can you imagine rolling up marijuana for your mother or cousin or brother? Can you imagine, and this is just inside the household before you go outside, and then can you imagine a child going outside where he sees bullet holes in the stop signs? Can you imagine being on the same street corner where you go to school at, you see people selling drugs to your family members? Can you imagine the idea of fun or playing hide and go seek is going into abandoned homes where you see drug paraphernalia, needles, baggies, maybe a dead body? Can you imagine the type of trauma? This is trauma that we face, but when we are portrayed, Black and brown faces are portrayed on the television, that's the part that they leave out. They just kind of leave that part out. And can you imagine being taught that money is more important than a person? That type of mentality. Or can you imagine going to school and the discouragement that someone will have for a little boy or a little girl that makes the basketball team, or they make the cheerleading squad, but they have to drop off or they can't go because their mother and father don't have money, or they don't have a car to get to the practice, and the community leaders or people like that say it's a lack of resources, so we can't get buses to take you guys out there to practice and just fully fulfill your dreams and things like that. Can you imagine the interactions that you have with police officers? Some of the pictures I see in different communities, police are helping little kids on bikes and passing out things to them. But in my community, the only time the police wanted to know your name was to see if you were in the system, or see if you was probably related to somebody that was in their system. So these things that you imagine, I want you to understand that these are the actual realities of many, many, many people. Growing up, I went to prison at the age of 16. Can you imagine that? A 16-year-old being sentenced to an adult prison with people that have 70, 80, 90, 100 years. Can you imagine that type of trauma and what that does to their mentality? And while they were inside, the resources provided were really not adequate. Some of the instructors and things like that could even be paid for you to pass your GED, or you to pass this vocational class, or you to pass this program that this facility has to offer. So these are just the realities that we face, that I face. Two of the most influential community organizations, I would say, in my life that had the biggest impact, one from my childhood, was a summer day camp ran by a pastor named Lewis Norris and his wife. They were great people. They showed us things outside of those little 8 blocks where we lived at. They took us to Indiana Beach and bowling and swimming, and they just invested their time into us. And that really stuck with me. And then as an adult, this little bitty old place called Pace. As I said, I had been in and out since the age of 16. My last commitment was actually, I was sentenced to almost a quarter century. But God had a different plan, so I only ended up doing like 5.5 years on that. Had my sentence modified. And the first place that I went was Pace. And they embraced me and opened their door. You know, they embraced me with open arms, opened their doors to me, and actually helped me build my foundation and helped me grow into the man that I am today. So I'm grateful, very grateful for that. A quote from Malcolm X, he once said, "The future belongs to those who are prepared for it, and education is our passport into the future." Specifically in the Martindale Brightwood area, the tearing down of that liquor store on 25th and Sherman, I believe that and replacing it with a library, that was like a major statement. And I actually respect and salute all city officials and give them credit for doing that. But with all due respect, we already had a Brightwood library. And me and many of the people in our community believe that it would be better served if we had more resource centers or maybe treatment facilities in some of these communities to directly address, you know, some of the disparities and things we face as it pertains to substance use disorder and just crime and criminal mentality. Poor, middle class, and rich is a mentality. It's really not a class, it's a mentality. So instead of just providing the resources to help us become better employees and renters, we actually need some of the resources to help us become employers and owners, because we can do that as well if we have access to those resources. We all know economic inequality has been building over decades, and it's fueled by structural racism. We understand the inequalities in the United States in our educational, financial, and healthcare systems. So when we speak about these things like revitalizing these neighborhoods and opportunity zones and recovery and treatment, how can you not include us? You have to include the people like us, because it's not the streets or the name that make up a community. It's the people with the lived experience that actually make up that community. So we are the community. You know, we are Martindale Brightwood. And I strongly believe that the time we're living in right now, you are seeing those that have been thrown away and forgotten. They're rising up and emerging as leaders, you know, from the cracks and crevices, and standing on the front line in this fight just to make things better for us as society and as a whole. And we just really, I'm just excited to be here right now. This is a perfect example of just what I like to call mistakes made beautiful. So I greatly appreciate all of you for listening. And I hope this is like the first step. Well, I know this is the first step into us being having an amplified voice, those with the lived experience having an amplified voice and having a seat at the table, because we actually earned it. We actually earned it. So I greatly appreciate you for your time. Thank you.
Wow. Thank you. Thank you. Awesome testimony. And I don't know if there's any thought about like a mobilization board with this issue, but if there is, Sharon needs to serve on that. I will, before I bring Representative Shackelford to make the closing remarks, I'd also like to direct our viewers to the PACE Indy website and look at the recovery tab to give to the Bradley Noel Fund. And this is a fund to assist the work that we will continue to do in regards to recovery. So thank you. And at this time, I'll bring Representative Shackelford.
Thank you, everyone. I agree that this has been a fruitful conversation. I'm glad we were able, everybody, to get together on different levels of government, plus the great participants, the community leaders, the people that gave great testimony. I think it gives an educational eye opening to a lot of people, and they'll be able to view this on Facebook later, even if they couldn't view it today, and get to see some of this dialogue. In closing, I just want to go over a proclamation that the Indiana Black Legislative Caucus is recognizing the great work of PACE and everything that they've been doing for Recovery Month through this proclamation, and just go over a couple of those whereases. Whereas recovery from mental and substance use disorders, including co-occurring disorders, is an essential part of health and one's overall wellness. And whereas treatment and recovery services for mental and substance use disorders and co-occurring disorders is effective, and people can do recovery in our area and around the nation. And whereas Public Advocates in Community Reentry, PACE, celebrates its 60th year of providing recovery services and support to the Martindale-Brightwood community. Now, therefore, be it resolved, the Indiana Black Legislative Caucus celebrates September 2020 as the 32nd anniversary of National Recovery Month, and recognize the continued support of recovery efforts by our community leaders. Thank you all for everything that you do. We appreciate every person that you treat, every person that comes through your door and you help. So thank you very much.
Thank you. Gina?
What an awesome day. Thank you. Thank you all so much. I just want to charge us all in continuing the work, continuing it, Councilman Osili, in our communities, in our families, in our churches, and doing this work to change the narrative and create and celebrate connections, and to restore and to recover the hope that our community innately possesses. Thank you all for being with us today. Visit our website, come by, see us. We appreciate you all. Thank you. Have a great day.
Thank you.